Yeah, Uncle is here. Welcome to today's topic, and I want to continue and discuss about. I want to continue and discuss about something that is important. Yes. Yes, we talked about the other types of medicine that are called over-the-counter medication. Walk and talk with Nettie. Hello, Ben. Doc is okay. Welcome, welcome, welcome. Walk and talk with Nettie. Pick up yourself every time. Weekend has been long. We have not interacted for some time, and we were talking about over-the-counter medication, but we finished it, and today we want to talk about prescription medication and their types. How is the going? It's Monday, and it's good. It's Monday, and it's good. We are doing good. We are doing good. So the going is fine. The going is fine. The day is a bit cold, but let me check out who is online. We have I've not. I can see Walk with Talk. Uncle is here. Check this out. So if you're coming in, if you're wondering the topic of the day is prescription medication. Very many prescription medication are out here. Many prescription medication are out here, but they are given over the counter. What is a prescription medication? This is a medication that needs a prescription from a trained personnel and a licensed one. There is a trained personnel who is not licensed, but there is a trained personnel who is licensed. Those are two different people. So we talk about prescription medication and we talk about trained personnel. And who are the trained personnel? Trained personnel are health workers, and there is a category of health workers that are trained about prescription medication. There is a trained personnel that cannot prescribe a certain kind of drug. There is a trained personnel that can prescribe all types of drug depending on the type of profession and training this person has attained. So there are so many things that we need to learn about the prescription meds that we abuse. People abuse over the counter, people abuse everywhere. These medications are dangerous. Medicine sometimes can be dangerous to your health. You are given medicine to help you, but if you're given medicine to help you and then you are using them without caution, because they help someone else somewhere, and you're the one that now has to take them as anyhow, you will have a problem. You will have the problem. So let's learn what are prescription medication first. Prescription medications are medicine that legally require authorizations from a qualified healthcare professional and have added license before they can be supplied or even used. Before they can be supplied and even used, the first thing we check out is the prescription itself and the recognition of the person who wrote them. They are generally used when medicine requires prescription medicine. They are generally used when a person requires a genuine and definitive diagnosis. What is a diagnosis? Something that is what is giving you a problem. Dose adjustment, and also as you are given these medications, you should be monitored or have significant risk if misused. Let's say things like antibiotics, antihypertensives, antidiabetics, and anti-seizures, antipsychotics, anticoagulants. Corticosteroids. Steroids are misused and then they give you. And I said one thing last time. If you are a man and you are misusing steroids, be careful. Be careful. And you understand why, what I said about if you didn't get it, go to the last talk, rewatch, get to know why. If you are a man, be careful with steroids. Asthma medicine, things like strong analgesics. I can see someone is laughing. Men that like to misuse steroids, you go to the gym and then you feel big biceps and you're using steroids. Be careful about steroids. Strong analgesics like morphine, oxycodone, fentanyl, and tramadol. These are analgesics. They help you to reduce pain, but they are controlled. So, thyroid medicine. Oh, walk and talk with me. To say is still here. Moharia is still here. Hello, my brother. Big up. Thyroid medicine. These are hormones. Thyroid medicines are hormones, and the way you use them without caution, you may end up having a problem. Levothyroxine, carbimazole, propyluracil, propylthiouracil. Those are drugs you should use with caution. Lipid-lowering medicine, atorvastatin, rovastatin, simvastatin. Those are prescription medication. I'm going all through. I started with antibiotics. I want you to listen carefully what we are saying. Antibiotics, antihypertensives, antidiabetics. Let me go through the list. Anti-epileptic, anti-seizures, antidepressants, antipsychotic, anticoagulants, corticosteroids, and asthma and COPD medicine. I know a man who liked to pump up himself and was approaching his 30s years, was dying for it. Yes, and to use steroids to be, you will die. Strong analgesics like morphine. You should not be closer to morphine. You should not be closer to something like oxycodone unless the doctor has advised. Tramadol. There are some people who are given tramadol and they fall down because of confusion. Lipid lowering like atorvastatin, they have their own problems. Hormonal medicines like levothyroxine, insulin, progesterone, combined hormonal contraceptives. You are using them and you are breastfeeding. They're like contraceptives, like combined contraceptives. You know, you should not use them when you are breastfeeding. That's why they are called prescribed medicine. Anti-cancers medicine, medicines. Methotrexate, they're commonly used when people have something like arthritis. People have done things like have ectopic pregnancies. They give methotrexate. Imatinib, sedative and anxiolytics. Sedative, diazepam, clonazepam, losartan, benzoxil. Those are things that are not supposed to be given without being followed, being monitored. Diuretics like furosemide, spironolactone, and hydrochlorothiazides. Those are called diuretics, and they work on your pressures. They are called antidiuretics. Antirhythmic like amiodarone, sotalol, and flasinidine. They are called anti-arrhythmic medicine. They help your heart to be on rhythm, not just to be anyhow. Medicine requires special monitoring like lithium, warfarin, and clozapine and methotrexate. Those are very important. So we have talked about 20 good categories. 20 good categories, and we are going to start with the one by one to know these categories of medicine. Why are they? To know that why are they called prescription medicine? So we'll start with antibiotics. Or let's start with what people misuse a lot. People misuse a lot. Let me check. People misuse a lot. Do people misuse a lot? I know you know. Eh? What kind of drugs do people misuse a lot? Generally, even at home. Tell me one. Eh? Tell me one. Tell me one you know. Tell me one you know. Which one do you misused a lot? I'm waiting for someone to tell me. Why? I want someone to tell me. Somebody don't know. Always people want to bring pain down when they are sick. So the kind of medicines that are misused are analgesics. Analgesics are the kind of medicine that are misused a lot out here. You know, Dorothy, enda huko kuna why are strong analgesics misused put on? Yes, welcome Miriam. I can see you. I can see Reha. I can see someone. I don't know that. Everyone don't know that analgesics are the ones. I don't know. You reply me. Painkillers. Let me say in a layman language. Painkillers are the ones which are misused a lot. Painkillers, and that's the category of drugs that we are starting with. Yes, those are the ones that are really misused. You see, we have 20 categories. We have 20 categories of drugs that are prescription, and when it is said we have prescription, we discussed why they are for monitoring and dose guidance. Maje, I can see you. Greetings, doctor, and everyone. Greetings, Maje. So analgesics, these strong analgesics, these strong painkillers, there is a reason why they are prescription only, and we have given something like morphine, an example like morphine. Has everyone ever used oxycodone here? If you have ever used oxycodone, you know the effects. Fentanyl, a drug that is really abused in the US by some youths there, and it is used in some drug laboratory that are illegal. Fentanyl. Yes? Yeah, you know that. Tramadol, the normal painkiller that people love. These strong analgesics, they can cause respiratory depression. Strong doses like these ones can cause someone to be slow on breathing. And you know, slowing the respiratory system, the airway, can make someone to have a problem. You can get myocardial infarction. You can get problems, headache. So it is not good. I'm giving some points why strong analgesics like morphine, oxycodone, and fentanyl, even tramadol, are supposed to be prescription only. They have a high risk of overdose because you want to kill the pain. A person who is under pressure, getting the pain, wants to kill the pain very fast. And you're there doing what? You see, overdosing yourself. The other thing is tolerance, and dependence. You know, you are not supposed to depend on some analgesics. You have to control whatever that is disturbing you so that you cannot depend on analgesics. And you know, these ones are morphine, oxycodone. There is a case a year ago of a child who was overdosed with morphine, and it's another case right now. Let me laugh, but doctor, those drugs are no joke. Yes, I see them. They are no joke. Morphine, oxycodone, and fentanyl are no joke. But you see, fentanyl is used illegally in drug business somewhere around the world, mostly in the South America, and you understand that. So when you use them over time, let me say you use oxycodone over time, what comes on? You get tolerance. You start having high doses to kill whatever that is giving you the pain. So I've started with analgesics because they are the most drugs that are misused out here. The normal paracetamol can be paracetamol. I know in the US you call it acetaminophen. The normal acetaminophen you use can be dangerous because it is hepatotoxic. It destroys your liver at high doses. So they need guidance. When you say that these drugs, Septrin, no, David Njoroge, Septrin is in a category of antibiotics. Today we are talking about analgesics, painkillers. Why are they under prescription medicine? You get drowsiness, and while you are driving, you have used fentanyl, and you are driving away at 110 kilometers per hour, and you doze off, cause mayhem. These are points that you should mark them down. You've been discharged from hospital on morphine, and the only painkiller that you want every time you feel pain is David Njoroge. I've said those are antibiotics. Today we are talking about analgesics. If we finish this, if you have time, we'll go there. So let's talk about something that is called, if you know any strong analgesics, please, have you eaten your meals? Mohan is asking me if I've eaten any meal. Do I look tired today? Or I'm talking so slowly? Cetirizine tablet is safe or dangerous one? Cetirizine is antihistamine. It's not dangerous. It's not dangerous. That's a mild antihistamine. David Njoroge is talking about antibiotics. Here we're talking about analgesics, painkillers. You know, sometimes they can interact with sedatives, particularly benzodiazepine. Benzodiazepine is a drug that is used as a sedative. When you are feeling like pain is too much, doctors may give you analgesics and give you some sedatives. I'm fine. I know from India, and India right now maybe, what's the time in India now? I think it's late. They can dangerously react with alcohol. For those people that are having withdrawal symptoms, they want to get away from pain, and you have been taking alcohol, you see, it can be a problem. They can be misused. Some people may take them for reason other than pain control, because some adverse effects that they are feeling is making them feel better. I talked about a drug called cyproheptadine and had antihistamine, and the other antihistamine that you use is, let me see, we have more. If you have any question about these drugs, not to be used as over the counter, you ask. You know, I like questions wherever that we are on session, not after session. The weekend has been long. We haven't been having any talk, but let's talk about them today. Check that drill. Yes, let's go on. Piriton is a good, but some medicine. Piriton is good, but some medicine. Piriton is an antihistamine. It has both the IV, the injection, and it has got the tablet. But overuse of it is not good. It's not good. Okay, so we have said analgesics can be misused. They have potential of addiction. They can cause nausea and vomiting, mostly oxycodone and fentanyl. They require individualized dosing, not everyone, because we say we need to get your weight, we need pharmacodynamics, we need pharmacokinetics, we need to know the availability so that you cannot get liver damage. What are you saying is good information, sir? Very useful. It is information that you should know. Yes. David Joroge, you are always funny. Now, they require dosage per person, not because the other person used one drug, you should use the one drug. Some require monitoring. Patients may need observation. You see why they are called strong prescription medicine and they are painkillers. They can be dangerous sometimes when you combine with other opioids. We have seen they can cause respiratory failure. You not to breathe well is a problem. We need you to breathe well so that you can be healthy. Prescription control promotes safe use of these drugs. The boards of your government everywhere and the people that are supposed to control the prescription should be following up on everything that is being done on this patient. Strong analgesics like fentanyl, oxycodone, and tramadol can make you lose your life. So the 20 points that I've said, I'll repeat them, and you listen carefully. They cause respiratory depression. They have a risk of overdose. They can cause dependence. They can cause tolerance. They can cause drowsiness. They can impair judgment and coordination, mostly when you are driving. Or working at a heavy machinery plant. They can interact dangerously with alcohol. Those people that take alcohol. Mirchi Mata from India. Mirchi Mata, how are you, bro? Yes, we are fine. We are fine. So let's continue. They may be misused. They have a potential for addiction. We don't want people to be addicted to analgesics. No. They require individual dosing because you may be suffering differently from the other person. They cause pain. The cause of pain should be assessed. This one. I have it here. I can't like it. I'm always having it because of my throat. So when you ask why strong analgesics are for prescription, now you understand what I'm saying. You understand what I'm saying? Because you can't go to a hospital because the other doctor used oxycodone to you that time. You want to tell the doctor, now I want the oxycodone this time, and you just only have a headache. You will not be given. Oxycodone can cause respiratory failure and you may die. They may interact with other drugs that you are using, like diabetic drugs, antihypertensive, autoimmune drugs. They may interact. So as before you are given, you are supposed to be assessed. Check your weight. check several points that I'm saying so that you can. Let's talk about the drugs that I've named, because some of you love these drugs. Some of you love oxycodone and fentanyl. I know oxycodone and fentanyl, only prescribing, or taking, requesting every doctor to. Now, morphine is a powerful opioid. It's an opioid. It can cause respiratory depression. You take morphine and you slow down in breathing. You can be dependent on morphine. Mostly people that have had previous fractures and nerve complications. And overdosing risk is very important when people are using morphine. So if you've ever used morphine, or if you are here a medical practitioner and you are always giving your patients morphine, be careful. We don't want dependence, and we don't want respiratory depression when people are in their homes and there is no doctor around and it is midnight. What do you want these people to do? For real, just imagine. Oxycodone, I'm just naming some of them. It's also a powerful opioid. It has dependence and sedation risk. When you take oxycodone, you pass out, be sedated. You wake up tomorrow when the bioavailability is nil. When it has gone down in your body, it has been cleared. So that's what when you wake up. There is another drug that people use a lot so that they can sleep. I'll tell you about it. It's really misused out here. Promethazine. Promethazine is used as a sedative agent, partially when you can do some surgeries, short-term surgeries, and people like them. They take them, and then you start having dependence, and you start having problems. Promethazine is not analgesics, but people like it. How to control alcohol from a heavy drinker. Now, my people, help Mohan Kumar. Mohan Kumar has a question here that should be answered by a psychiatrist and a counselor. How to control. Let's see, Mohan, who is having problems with alcohol? Who is this having problems with alcohol? Mohan, who is this who is having problems with alcohol? Who is this having a problem with alcohol? There are some things that you know. Before we continue on analgesics, let's talk about that question. You have to, the first thing you need to do, because people don't just take alcohol. Okay, I see. Acknowledge the problem. Help the person to recognize the alcohol is affecting their health, relationship, work, or finances. 1. You get? Set a clear goal. Depending on severity, the goal may be reducing alcohol or completely avoiding the alcohol. See a healthcare professional, especially if they drink heavily every day. If someone is drinking heavily every day, you need a professional. But first of all, you need to acknowledge the problem. The problem is making that person to know that alcohol drinking is not okay, and it's affecting his or her relationship, work, and finances also. It's very important when you go that way. Identify, make the person, talk to the person as a relative, be friendly, not harsh, so that this person can accept the line that you are going to. Do not suddenly stop heavy drinking without medical advice. You'll get some problems. You can get severe seizures, you can get hallucinations, you can get delirium. Identify triggers such as stress, loneliness, certain friends, places, or emotions. What do this person, how does alcohol affect the body? It is bad. It's bad. You can get seizures, you can get liver dysfunction, you can get very many problems. Replace alcohol with another thing like exercise, walking, hobbies, work, social activities. Build family support, get counseling or psychotherapy. Consider support groups to help this person. Treat underlying mental health problem like anxiety, if this person has depression, if this person has trauma, previous traumas that are making him drink, that can contribute to drinking. Improve sleep and nutrition. Heavy drinking can cause disrupt both. Keep a drinking diary. Develop coping strategy. Consider medication if it is when appropriate. Prevent relapse and continue on following this person. If a person gets shaking, sweating, anxiety, vomiting, confusion, hallucination, or seizures, when they don't drink, they may be feeling physically dependent on the alcohol. Take this person to a professional and don't tell them to stop the alcohol immediately. That's a bad effect, very bad. So let's continue on our topic. I think Mohan, you have gone through whatever that I've advised you. So I've said this prescription medicine, the strong analgesics. The strong analgesics, they can cause respiratory depression. They have a risk of overdose. They can cause dependence. They can cause tolerance. They can cause drowsiness. They can impair judgment and coordination. They interact dangerously with alcohol. They can interact with sedatives. They may be misused. They have a potential of addiction. They can cause, you can feel nauseated and vomit. And when you vomit a lot, you have electrolyte imbalance. They can cause pain. Should be assessed first. They can be dangerous when combined with other things. They can be dangerous when combined with other things. Just a minute. Yes, so we are talking about tramadol as an additional risk. People that like tramadol, they have additional risks like it can increase the risk of seizures and serotonin syndrome, particularly when certain antidepressant and others medicine. Serotonin syndrome, Tramadol. Who has ever used tramadol? Some people are given tramadol and they pass out. When what is a permanent solution to quitting drinking? A permanent solution for quitting drinking is just to stop. Just stop drinking. Just stop the drinking, because if you continue drinking alcohol, you will continue needing more. So just stop drinking alcohol and and be okay. Yes, you will suffer for some time, have problems for some time, but after some time, you will be okay. You know, that is about Moha. Mohan is asking. So those are the points that I've said strong analgesics are, why strong analgesics should be prescribed. And you have seen strong analgesics is a habit that easily stopped. Just a minute, my guys. Yes, let's continue, my friends. Let's continue. About anyone with a question on analgesics, strong painkillers. I've given 20 points, and the points are they can cause respiratory depression, they have a risk of overdose, they can cause dependence, they can cause tolerance, they can cause drowsiness. They can cause drowsiness, they can impair judgment and coordination, and they can interact dangerously with alcohol. Those people who are taking alcohol, these strong painkillers are not okay for you. They can interact dangerously with alcohol. Okay, they may be misused. Some people may take them for reasons that other than pain. Because you want to sleep, you are depressed, you take them so that you pass out, like oxycodone. Have potential of addiction. Can be addicted to medication like fentanyl. They can cause, the cause of pain should be assessed. You should assess the cause of pain. You get? And require monitoring. They require monitoring. So this is very important. Fentanyl is extremely potent. Small dose can have serious consequences. So it requires particular care. Prescription control promotes safe use for analgesics, but they can't stop at once. Maybe reduce the number of amount they drink, also start reduce the number of days taking alcohol. It depends. Sometimes when you stop taking alcohol and you start having seizures, stop taking alcohol and you start having seizures, you need to be tapered off. That is what you are saying. Little by little, you get off. Little by little. But if you are not having seizures when you stop, you just stop. Just do what? Just stop. You see, alcohol dependence is a bad thing. And some people, when they take alcohol, next day they get headaches, they continue taking alcohol. The headache does not stop. You are high. Then after some time you mix alcohol with drugs, painkillers, and you want to go for the higher painkillers like morphine. It is not good. You have to be very careful with analgesics. So the 20 points, you should put them on consideration. When and this analgesic misuse comes when a person, most of the people that misuse these strong analgesics or strong painkillers are people that have been mostly hospitalized, or that they have been through a therapy of a doctor somewhere, or they have been through they have taken through someone on some medical care. So you find that this person, the drug that he was given with a particular doctor, he needs just that drug, You only need that drug because you know it works well. When you take it, you sleep off, you don't feel the pain. You see. But why should you do that? Only you should go to a qualified doctor, licensed doctor, health worker. Give your symptom, explain, because pain, we are talking about analgesics, and pain does not just come because of one thing. The pain may be because of something else, and every pain that you have in your body is treated different. So it's better you check on a professional to know how to manage your pain. If you have taken a painkiller or an analgesic and it's not working, for the second day, stop taking analgesics and check. Stop taking the analgesics and check the right thing to do. Go to a doctor, go to a medical practitioner. You see, it's very important things we should learn here. So that point I think is taken. Some painkillers may make you vomit. Some painkillers may make you have seizures. Yeah? Some like tramadol. Some painkillers may make you those normal strong painkillers that you usually like are problems. You call them strong painkillers because you understand how they work. So the more they work strong, the more bad adverse effects they have. So we should not go for stronger analgesics over the counter. We should go for prescriptions from people that are registered. Check that out. It's very important. Very important. When you take some strong analgesics and opioids can cause constipation. So that is about these strong analgesics. Let me check on some strong analgesics and their adverse effects. Let me check on some strong analgesics and their adverse effects. And when I'm saying strong, they are those drugs that are prescription only. Let's talk about morphine. Morphine can give you drowsiness, nausea, vomiting, constipation, dizziness, itchiness, low blood pressure, respiratory depression, and tolerance and dependence. The more you take, the more you need a higher dose than yesterday. That is tolerance. The more you are given, the more you need a higher dose than yesterday for you to be stable. Oxycodone, sedation. Taking oxycodone at work, and you because of pain, and you find yourself lying on the desk, dizziness, nausea, vomiting. All of the opioids that I'm naming may give you something that is called constipation, respiratory depression, dependence and overdose. It's not good you depend on some drugs so that you can live. Now let's talk about tramadol. I know many of the people here knows about tramadol, and some of you are dependent on tramadol. Some of you are dependent on tramadol. Without tramadol, you always say, I've not taken my drug of choice. Tramadol. You see, tramadol can give you can get a seizure, you can get a headache, you can get constipation when you are dependent, drowsiness, dizziness, and respiratory depression. All opioids can make your breathing system to shut down. Mostly when you are giving it intravenous and fast. Dependence and serotonin syndrome with certain medicine. Someone is asking me what is serotonin syndrome. Serotonin, we talked about serotonin in our other topic of mental health. Serotonin syndrome is dangerous drug reaction caused by too much serotonin in the brain. Most of happen when you mix two medicines and strong analgesics, and then you get high fever, fast rate, your heart beats so faster, and muscle stiffness and confusion because of serotonin syndrome. Sedation, nausea, vomiting, constipation, dizziness, respiratory depression, and dependence is caused by hydromorphone. It's also a drug called hydromorphone, and it can give you all these problems. We are talking about most of these analgesics, these painkillers that are strong, most of them are opioids. So they share the same characteristics. But you see, something like tramadol has serotonin syndrome. When you are injected, it causes serotonin from your brain to come out so in high rates. And when it comes out in high rates, what happens? You start being confused. Methadone. Let's now talk about methadone. Methadone, the drug that makes people, those that are alcoholics, you are going to be given the methadone dose. Methadone gives you sedation, constipation, nausea, just like other opioids, and it may give your heart arrhythmias. When it gives your heart arrhythmias, you have problems to beat rhythmically, give you bradycardia and tachycardias. Your heart beating so slow or so fast. You need a specific rhythm so that your body can pump out blood as per needed. Codeine, drowsiness, constipation. Those people that use drugs that have codeine, syrups and painkillers that have codeine. This drug is regulated because it can give you drowsiness, constipation, nausea, vomiting, dizziness, respiratory depression, and dependence. So these drugs that I've named, like the ones that I've gone through, the drugs that I've gone through, like morphine, oxycodone, fentanyl, tramadol, hydromorphone, methadone, codeine. One thing, all of them, they share the same effect. But one or two things like tramadol causing serotonin effect and methadone having arrhythmias, but they share the same effect. The major adverse effects to remember, you remember, are like respiratory depression, sedation. When you are taking them, you are at work and you want to kill pain and you're going for them, or you are prescribed, take care of respiratory depression. When you feel you are not breathing well, call out for help. Sedation, constipation, nausea and vomiting, dizziness and impaired coordination, low blood pressure in some patients, and tolerance, physical dependence and misuse and addiction, overdose. These are things that you should take care of when you're taking these strong analgesics. You understand? Very important when you are taking these drugs. And some people may be taking them and they don't care why they are taking them. You see why they are taking them. So let's talk about what you should not do when you're taking these drugs. What you should not do. We are talking about analgesics today. We can see that there is the combination of opioids with alcohol, benzodiazepines, or sedating medicine can substantially increase the risk of dangerous respiratory issues. So if you have taken alcohol, someone should not use these opioids. Someone who is using benzodiazepine for the sedating or sedating medicines should not use this strong analgesic called. You should not. Why should you not do is, I want you to know, when you're taking strong analgesics you are prescribed, don't take more than what the dosage you are given. Don't take more than the dosage you are given, because some people will always take more than what they are given so that the effect can be higher. Do not take them for frequent than prescribed. Follow the sequence. If the second day you are not getting any effect, go back to the doctor. Never combine analgesics, drugs of strong potency like strong analgesics, with alcohol. Never use alcohol when using them. Do not combine them with sleeping pills and sedatives and benzodiazepines unless specially approved by your healthcare, because they will determine the dosage that you should have and very many things according to your complication. When you are doing heavy machinery or driving a long distance, don't do what? Use them. Those people that like sharing medication, advise yourself not to use a strong medication, opioid, when, do not increase the dose because the medicine seems less effective. That's what I've said. You don't increase the dose. This indicates the tolerance and need for medical review. You don't want people that are getting tolerance to some medicine, mostly strong analgesics. No. And do not suddenly stop opioids treatment unless you go and ask your practitioner, medical practitioner. Do not ignore severe constipation. Do not ignore slow, shallow, or difficulty in breathing. Do not mix tramadol with certain antidepressants without medical advice because of the risk of serotonin syndrome and seizures. You will get hallucination and you will pass out. Tramadol, those people that use tramadol, like using tramadol. Do not take extra dose after forgetting what you are supposed to take. You would always not allowed to combine medicine without medical advice. So these strong analgesics that you have, you should not combine with other drugs that you are not advised by your practitioner or your health service person. Get an information before. Once you understand that you are on analgesics that are strong, be careful. Now, do not use opioids to treat pain without determining the cause of pain. And I've said people have different types of pain. You may be thinking it's like the other pain that your friend has, so you borrow them, but it's different. Do not keep them where children and other persons can access. They are yours or prescribed person. Keep them very far away. Do not dispose of unused opioids casually. Follow the local pharmacies. You know, drugs that are prescribed, when you want to dispose them, you should take them back to the pharmacies, any pharmacy, to follow the right procedure to dispose them. I don't know if your country, if you have a place where disposal of medicine, you should take them. Usually having a place that they receive the drugs of disposal. I don't know if any country has where you are in your country, but they should be having a place for medical disposals. You know, if someone is taking opioids, it becomes very difficult to wake up. Life with Marie, welcome Life with Marie, has slow, shallow, or stopped breathing, or develops blue-gray lips. That is called cyanosis or skin. This is possible opioid overdose. Seek emergency help. If you see someone has blue-gray lips, seek help. Or you feel that this person is partially breathing, get help before things are worse. You get help before things are worse. So that is why these drugs are prescription medicine, analgesics, painkillers, the strong painkillers. You know, so I've gone through. We will do antibiotics next. We have started with analgesics, painkillers, because I saw analgesics are the ones that are really abused. Are really abused out here, and sometimes when you tell people stop taking randomly analgesics, they'll tell you, no, what do you want me to do? They'll tell you, what do you want me to do? You should go to the doctor to get help. And you've seen analgesics like paracetamol can destroy your liver, and it's a normal medication. And we have the other one, which is tramadol. What can tramadol do? Serotonin effect that can cause seizures. You take some medication and you start getting seizures. Very important for you to understand. Very important for you to understand. Medical problems are sorted by health practitioners. So sorry, there are some kids here. Don't worry about it. So anyone with any question about it? Anyone with any question? Anyone with any question? We have very many types of prescription medicine, and we have started with analgesics. So antibiotics, antihistamine, antihypertensives, anti-epileptics. Let me go through. Yes, atapiga kelele tafadhali. We have antibiotics, antihypertensives, you have antidiabetics, and anti-epileptics, antidepressants. Those are the drugs that we should be learning when thyroid medicine. Why are they prescription medicine? We will go one-on-one with them until we do all of them, until we study all of them. So Anyone with a question? Anyone who has a question, my friends, bring it before I log off. What is the problem? Who is disturbed? What is the problem?
No, this one. This one is saying, he's saying that we stop looking at me. And I'm not even looking at you. And then, some certain, the mother my shoes, and the one who like here.
Yes. Blessings, Dr. Benjamin. In the chat. Monday, I'm watching and working. Thanks a lot. Now, anyone with a question today? It has been a session of 1 hour. Maybe I'll come back later to check what we can do later. Anyone with any question? Anyone with any question? We check on. We have started with analgesics, and we have so many. Anyone with any question? Let me go through the drugs that we will go through. Let me go through the drugs that we will go through. Yes, Jehang, Miriam, welcome. The drugs that we will learn and know why they are prescription medicine alone are several. These are antibiotics, antihypertensive, anti-diabetic medicine, anti-epileptics, and antidepressants, antipsychotics, anticoagulants. If you are using these drugs, I purport you will have to ask a question. Corticosteroid, asthma drugs, strong analgesics. We have done about strong analgesics today. Oh, nice. Thyroid medicine, lipid lowering medicine. There are some people who are on lipid lowering medicine. Well, lipid lowering medicine, and we have something that is called anti-ulcer, omeprazole, pantoprazole, formatidine. All these drugs. I'm naming some the drugs that are for prescription. Hormonal medicine like levothyroxine and progesterone, they are for prescription. Immunosuppressants like methotrexate, cyclosporine, tacrolimus, and azathioprazole. If I name a drug that you are taking, you can tell us, yes, I'm taking that medication. Sedatives and anxiolytics like diazepam, lozapam, and clozapam. These are drugs that should be for prescription. Anyone taking some of these drugs? If you are taking some of these drugs, please tell me. I can help you with some message and some. See, these are important drugs. Diuretics are drugs for prescription. Diuretics are prescription drugs. Let me check this. No. Yes. Anyone with any question, or you have just come in and you're confused on what you are doing? We are talking about painkillers and why they are called drugs of prescription. I can see Life with Marie, Jay Hank is here, the American Uncle, everyone that is here, Burnout to be Blessed, big up yourself. Mohan Kumar, Reha, all that are here. If you have a question, you can ask before I log out. Before I log out of the platform, you can ask any questions, and we will support each other, and we'll try and talk to you about what you should not take and what you should take. You see, today is a Monday. You know, on Monday, many people have headaches at work. They have headaches at home. You have had a very long weekend, and you are using oxycodone, so the pain is not getting through. You continue adding the medication, you continue making it. What you are doing is you are making yourself to have high potency, you know, and it's not good. And tolerance. You take a high dose of analgesics, you be tolerant on it. You continuously add the dose. Every day that you want to use it, you use a higher dose. You see, so it is important to understand that some drugs are not just used for the purpose of killing pain. Some drugs are strictly advised by the doctor on how to take them. On how to take these drugs. So let's adhere to the analgesics protocol, painkillers protocol. Let's use them as how they are supposed to be used. Let's not just use painkillers because we want to use painkillers. You see, strong analgesics are very bad. Strong analgesics are very bad. If you are coming here today, right now, and you are confused on what you are doing, we are talking about strong analgesics and drugs of importance. Drugs that you should not just go to a doctor or and you instruct the doctor, I want this drug. Get me right? Very important point that we're talking about. Very important issues. So I'm still waiting for any question from people on anything that you think. If you're taking a drug that you need an advice, Johnny be good. We will learn antibiotics, all those drugs that I've named. We will go through them step by step. And understand how they are supposed to be used. You get? So there is a positive part when you come to use these drugs. They can provide powerful painful relief, which is better. They are used for severe acute pain, acute, not long term. They are used in cancer pain because cancer continuously gives you pain, so they release. My painkiller is coffee. I'm drinking right now. I see. Going to be good. They reduce the perception of pain, and they can improve comfort and functional. Get to your normal work. Those are the advantages. Everything that has something of a negative effect has got an advantage. And you see, they can provide instant pain relief. These are stronger analgesics like tramadol, fentanyl, oxycodone, and morphine. They can be used during medical procedures. When you are getting like a minor surgery like For example, it's commonly used in anesthesia and procedural settings because it's very potent and acts rapidly. That is fentanyl. And they are used in hospitals, not outside there. They reduce perception of pain. They improve functionality. Guys, let me come. Just a minute, I come.
maziwa Ukweli Junior School na vilevile Ukweli School Kamati. Kwa hivyo tunawakaribisha wote mkaweza kufika kwa any of our classes and feel free to make an inquiry.
Yes, my friends, I'm here, there. Just relax. I'll be back.
Unaweza kupata usaidizi na vilevile unaweza kusajili mwanao ili akaweze kupata quality education. Wananchi tunawakaribisha kwa furaha na sasa iliyo kifani na kwamba kama wanasoma tumejawa na furaha kuwakaribisha inategemea group of schools. Unaweza kumpeleka mtoto wako katika tawi lolote, tawi la KBS School au West KBS School Maziwa, KBS School Maziwa, vilevile KBS Junior na KBS School Kamati. Kwa hivyo waweza kutembelea tawi letu lolote na kupata kusajili mtoto wako bure. Because it's a high class school.
Yes, guys, I'm here. I've been checking on a patient there. I can see people don't have for splinter in my foot. We use kerosene oil that burn overnight and scrub green bananas that time. Hey, Johnny Be Good. Efasi Lipenga is here. Johnny Be Good has a good prescription there for dealing with pain. Eh? Johnny Be Good has a good prescription there of dealing with pain. Let me check this. Let me check this. Let me check something that is important. I'm looking at questions. That is for splinter we use there. Sapping the knee pain gone right away. Sapping the knee pain. What is sapping? Tell Dr. Benjamin about the white ram made with scorpion that our fourth parents used to use for pain. Jamaican uncle, please tell me that. Please tell me that the white ram. What is white ram made with scorpion that I'm also learning about the native things. Fourth parents use for pain. Yes, that is from Johnny Be Good. Johnny Be Good, what is that? I want to know it. I want to learn. Okay, Efasi, greetings, Benjamin. Efasi, thanks for coming in. I think I have 3 minutes, I log out. My people, I have 3 minutes, I log out. 3 minutes. Anyone with any question? Anyone with any question? White ram. I'm asking Johnny Be Good about the pimeto. White ram pimeto. What is that? Johnny Be Good, please tell me what is that. What is that? You know, we come here to interact, at least we learn. And I love when people are giving their when people are giving their in. Let me give this to. I was saying, I like it when you come and I like it when we come here. You know, medical, like what Johnny Be Good is saying. Johnny Be Good is telling us the white ram pimeto. Those are things that we love to learn. Those are things that we love to interact and know how they were used. They may be medicinal and they may be having the medicine that we are using right now in hospital. So when you are coming to my channel and we are discussing important issues like these ones, always don't be afraid. Don't be afraid to tell me that this is what we were using and this is what, because some things may feel primitive, you know, some things may feel primitive, but they are important. So when you come to my channel, don't feel bad to say whatever you have in your heart. They may feel primitive, but they are best options. So we research on them and then we talk about them. See. So my friends and everyone who is watching and everyone, your support and your interaction is very important. Let's get the interactive part. Let's learn about tactics of handling some things when we are at home, because these things may save a life and they may get away with mismanagement when it is not fatal. So let's get to interact, my people. We get to interact. I love when we talk, we interact, we talk about these things, we talk about everything that is medical, even mental health. So whoever who has been watching, everyone who has been on my channel today, please always share my channel out there. Let's get growing. And if you feel you have a person here you are watching and you see this is a new person, I've never seen this person in my channel, go and subscribe to that channel. It gives a massive social group that we interact from. You see, so let's get the interactive session going. Let's get to help people out here with tips, and let's get to make them know that some tips are for first aid and some tips are not for first aid. They are supposed to be given by a real doctor. You see. So those are the points that we come here. We give the interaction room. We talk about them. We talk about them and we interact. So guys, if you are watching and you have been here, you've learned something, you appreciate by telling us something. I love everyone that interacts in my channel, how we communicate to each other. You see, we have talked about analgesics of prescription. This week we are talking about prescription medicine. We have talked about analgesics of prescription, and next time we're going to talk about antibiotics. We're going to talk about antibiotics. So Johnny B. Good has left. I really wanted Johnny B. Good to tell us what is that I've seen. He has tested. Let me check. He has said, for splinter in the foot, we use kerosene oil that burn overnight and scrape green banana and tie it around it for kerosene oil. And then he has said to Jamaican uncle Benjamin, Jamaican uncle, tell Dr. Benjamin about the white ram pimento with scorpion that our foreparents used for pain. Those are things that I really need to understand. You see, someone may think it's primitive, but it is medically working. So thank you everyone who has been here. Let's meet tomorrow when we are talking about antibiotics of prescription. So bye bye guys. See you. God bless you.